You see the off switch. Okay, to the right, to the right, to the right. Nope. Click that one back on. There we go.
Good afternoon. This is Dr. Carmela Sgarlata. Thank you for joining us for today's webinar. We're going to be talking about preconceptual health and optimization for fertility. Thank you for joining us. If you do have questions, you're certainly welcome to, in real time, ask your questions, and then we'll answer them at the end of today's presentation. I think we've got all of our technical glitches out of the way and like to proceed. And again, thank you for joining us today. So today we're going to talk about a number of different topics, but the first is really preconceptual planning. For those of you who may just be beginning on the journey of planning a family or just beginning in the world of infertility, there are a number of things we'd like you to think about as you begin to plan and continue to work toward establishing and adding to your family. And there are a number of things that we need to look at to anticipate what is necessary for successful reproduction, and that's really what this slide goes through, the number of steps that have to occur for fertility to occur successfully. So number one is we have to produce both egg and sperm. So the woman has to produce a healthy normal egg, and if there is a male partner, there has to be normal fertile male sperm. Intercourse has to occur at the proper time, or insemination occur at the proper time around ovulation for pregnancy to occur. And beyond that, we have to have an open path. At least one of the woman's fallopian tubes needs to be open for the egg and sperm to be able to meet and fertilize in the fallopian tube, move to the uterus, and implant approximately 3 to 5 days after ovulation has occurred. So all these different steps have to occur and occur quite effectively in nature. But unfortunately, many individuals and couples do have fertility issues. And these are the areas that we will concentrate on if we do a fertility evaluation. We'll look at evaluation of ovulation, the sperm parameters, and then to make sure that the freeway is open, if you would, that the fallopian tube or tubes are open and there's no obstruction for a sperm and egg meeting together. Why prepare? Well, one of the things that many people think is that, well, my period starts today, I ovulate in 2 weeks, I can go ahead and establish lifestyle things in the next 2 weeks, and that will help. And that's certainly a good concept. But we know from biology that the human egg actually begins to awaken some 3 to 6 months prior to the actual ovulation events occurring. So the things that we may do from a lifestyle or habit standpoint from 3 to 6 months prior to the time of ovulation can have potential negative or adverse effects on the quality of the egg or ovulation itself. And in a similar manner, in men, we know that sperm production cycles are approximately 90 days, so that sperm are being produced all the time in men, but this sperm production cycle is a 90-day process. So things that occur 30, 60, 70 days prior to an ejaculation around ovulation can potentially have a negative influence. For example, if men have a high heat exposure, such as several hot tub usages 2 or 3 months prior to anticipated ovulation, this can have a negative effect and potentially lead to fertility issues. So avoidance of certain environmental factors can make a great difference for both men and women. So we generally like to say, think at least 3 months in advance and begin to plan and establish lifestyle habits that are healthy for fertility prior to conception. But realize that this is not always possible, but it's certainly a goal that is one we'd love to achieve. So let's consider a number of different factors today that we might have some influence in preparing for pregnancy, and this is true for both women and men. One is genetics, certainly the genes that we're born with, but also things that we do in the environment and lifestyle factors can change how our genes, our DNA actually interacts and functions. We like to concentrate on lifestyle quite a bit today, along with that diet and environment. And all of these can have a positive influence on successful conception and pregnancy. I always tell patients when we have these type of presentations, we're going to go over a number of different topics. I don't expect individuals or couples to change everything that they're doing in one day, but I'd like you to think about perhaps 2 or 3 of the topics we discussed today, areas that you might begin to work on to help improve your opportunities for successful conception. So in pre-pregnancy planning, one of the questions that patients often ask are, what are my chances of getting pregnant? And that's what this chart actually shows. If you look toward the left of the graphic, we'll see age. And we see at age 25, which we consider probably peak fertility, that the average monthly pregnancy rate when an individual or couple are just beginning to attempt pregnancy is around 18 to 20% per month. If we look at a 40-year-old woman at the time of attempting pregnancy, her chance of pregnancy is about 7% a month. So this chart does show that age has an influence on fertility. And also if we look going across the chart from left to right, we look at the number of months, the further out we are from attempting without success, the lower the monthly pregnancy rate is. And this is one of the bases for the definition of infertility, which is 12 months of regular unprotected intercourse or opportunity with pregnancy without a successful conception in women less than 35 years of age. Age does matter, as that previous chart showed, and also as this graph shows. If we look on this graph, we're going to see 2 curves. The first is an age axis, and you'll see me drawing in freehand and outlining in purple age. And what this shows us is with increasing maternal age, unfortunately, fertility rates decline, and they decline rather significantly. We think fertility begins to decline in women in the early to mid-30s, with a more dramatic decline in the late 30s and early 40s. Now, that doesn't mean that a woman at 40 can't have a child. Simply says statistically, based on populations, the chances of success are smaller. The other curve that we see that I'll now draw in is the risk of miscarriage. And what we see with this curve, unfortunately, is with increasing age, there is an increased risk of miscarriage. And this does appear to be related to maternal, not paternal age. So it's important to consider that age can have negative or detrimental influences on both the ability to become pregnant as well as maintaining a pregnancy. In men, fertility declines occur much later and are much more subtle. Probably declines in male fertility really begin significantly in the mid to late 40s and early 50s, but there appears to be no age limit for men to father children. We do note, however, that with increasing age, men's sperm quality does have some small changes, especially in the morphology or the shape of the sperm and motility, and this may lead to a longer time to conception for couples. Fertility timing is a common question that we're asked. What is the optimal time for fertility? As we know, the woman's menstrual cycle is broken into a number of regions, and this is what the left plate shows us. Generally, from when the time of menstrual period begins, which is called day 1 of the cycle, most women are going to ovulate approximately 12 to 16 days following that. With the idealized 28-day cycle, ovulation occurs around day 14 of the cycle. We know from a number of studies that the peak time, the optimal time for fertility, is intercourse prior or preceding the time of ovulation. So the highest rates of pregnancy occur if a couple or individual has timing of intercourse or placement of sperm with insemination in the body near or around ovulation. Within 24 hours after ovulation, the egg is no longer fertile, so conception is very unlikely to occur. And that's what we see in this particular diagram to the right, is we see peak fertility levels are going to occur around the time of ovulation and then drop off quite dramatically afterwards. So for fertility timing, the best intercourse for pregnancy is intercourse daily to every other day. This will yield the highest chance for pregnancy. We know in men that frequent or repetitive ejaculations generally will not reduce sperm quality or number substantially. There are some exceptions, men with very, very low sperm volume or very low sperm counts may see a significant drop in sperm count with repetitive ejaculations. This could be an important point so that once a semen analysis has been obtained, the provider can give you your best idea of what is your optimal time for ejaculation around conception. We do know that delayed ejaculation, men have several days between ejaculations before attempting conception, there is a decrease or decline in sperm quality. And this is due to oxidative stress, increased chemicals within the seminal fluid, and also some damage to the DNA, fragmentation to the sperm, the longer they're within the reproductive tract without ejaculation. So there is a great advantage to repetitive, recurrent intercourse for improving the opportunity for pregnancy. As far as specific guidelines for time of day, position, there are no specific guidelines or no specific time of day positions that will necessarily improve or increase the chance for pregnancy. And one area that is important is many individuals may choose to use a lubricant around the time of intercourse. While lubricants can be very helpful, many of the lubricants available actually have toxicity to sperm and may reduce fertility. And that's why we generally advise avoiding lubricants. If you're going to use a lubricant, use one that is a more natural lubricant, less likely to affect sperm, such as hydroxycellulose-based commercial lubricants, or some of the oils such as canola, almond, and coconut oil. If you have any questions about the use of lubricants, ask your provider. They'll be able to give you guidance. I mentioned genetics, and there are really two forms of genetics that we think about. One are the genes that we're born with. We're born with 46 chromosomes that we inherit from our parents, and we can't really do anything about those genes. And then there is a concept of epigenetics, and that is how environment and lifestyle can actually influence our genes and turn on and off certain genes as far as both lifestyle affecting general health as well as fertility. A point about genetics, there are a number of genetic screening tests now available to individuals and couples preconceptually. And the concept of these genetic tests are to screen for single gene disorders of one gene that may increase the risk of certain types of birth defects. This type of screening can be very helpful so that if a couple is found both to be a carrier of a specific condition, they can understand what their risks are to have a child with that condition and may choose different options for therapy. The current level of screening we have from genetic screening cannot screen or prevent all genetic disorders in pregnancy, unfortunately. Lifestyle and fertility is a very important issue. Many of the lifestyle factors are very similar for men and women, but we'll point out and contrast the differences. For both men and women, there are no reproductive advantages or improvement in fertility with use of tobacco, smoke, or smoking. Any individual who is smoking, I highly advise to cease smoking prior to attempting pregnancy. And we also recommend that smoking should not be utilized throughout the time of a woman's pregnancy. This also includes electronic cigarettes and vaping. There's not good evidence that these forms are any safer than conventional tobacco smoking. So we strongly advise individuals to avoid vaping when they're attempting pregnancy, and again, women during pregnancy. We simply don't have any safety information at this point in time. Marijuana use is generally advised to be avoided when women are attempting pregnancy and during pregnancy. We simply don't have good evidence-based medicine to give us any information about the safety of marijuana use, especially during pregnancy. And that's true both for inhaled marijuana products as well as edibles and oils. For men, there are some studies that show that marijuana use, chronic use of marijuana, and these studies we're looking at inhaled marijuana products, can show declines in sperm quality and motility, and in some men have a negative effect on libido and reduce sperm drive. For alcohol, during pregnancy, there's no safe amount of alcohol that's advised, but preconceptually, it appears that if both men and women consume between 2 to 4 alcoholic beverages a week, but no more than that. It does not seem to have an adverse or negative influence on the ability to successfully conceive. Again, once a woman does become pregnant, we advise no alcohol intake during pregnancy. Caffeine is a common question that's asked. And there are a number of studies linking the possibility of caffeine with infertility and even miscarriage. Most of the information would say that modest caffeine consumption for women, modest would be 200 milligrams a day, which is approximately 12 ounces of brewed coffee, does seem to be safe, does not reduce fertility, and does not increase the risk of miscarriage. Concerns of caffeine are with higher amounts, especially above 500 milligrams of caffeinated products a day. For men, there's a couple special areas we worry about, one of which is heat. We know that sperm production is very sensitive to heat, so men that work in high heat environments, use of hot tubs, as I previously mentioned, can have negative or detrimental influence on sperm production. There's always the question of boxers versus briefs. And there are studies that show that boxer shorts, men who wear boxer shorts seem to have improved sperm parameters. Whether or not that improves fertility is unlikely. But generally what I advise, especially if a man has a lower marginal sperm count, is it may be worthwhile to switch if he's using briefs to boxers for the cooling effect. We also suggest for men to keep cell phones out of their front pants pockets. Cell phones can give off small amounts of electromagnetic radiation, and there are a number of both laboratory as well as in-body studies to show that electromagnetic radiation can have negative or detrimental influence on sperm production and quality. This next slide simply shows what a serving of alcohol is, and this is important because generally a regular beer, one that's between 3 to 4% alcohol, a serving would be 12 ounces. Wine, 5 ounces, and hard alcohol, 1 to 2 ounces, depending on the alcohol content. You can see from this graphic that if somebody drinks a 24-ounce glass of beer, that's actually the equivalent to 2 servings, not 1 serving, simply based on the size of the vessel. The same would be true for wine or hard alcohol. So the recommendations are to limit alcohol to 2 to 4 servings of these size per week for both men and women. As I mentioned about cannabis or marijuana, we don't have great information. As more data comes out, we do know that there's both the active components CBD and THC within marijuana products. The THC is the one that has the most research on it towards its adverse effects, especially for male fertility. So at this point in time, what we can say is the literature does not support regular chronic use of marijuana products, either CBD or THC, in couples attempting pregnancy or in women during pregnancy. And as I said earlier, at this time, there's no established safe amount of any marijuana product for use in pregnancy. Weight is an important lifestyle issue that we do consider for fertility. Optimal body mass, and body mass is a measurement of both height and weight, looking at body composition, if you would, more than just weight, is considered between 18 and 25. We know that in the United States that more than 30% of Americans are now considered either overweight or obese. So we are a heavier society now than we have been at any time in our recorded history for Americans. We know that body weight and body mass can have influence, especially for women. In women who are very thin, of body mass under 18.5 especially, those women often have greater risk of lack of ovulation, irregular ovulation, or ovulatory problems. And in women with body masses that are considered obese, more than 30, and especially beyond 35, again, we begin to see ovulatory issues, lack of regular ovulation, or quality of timing of ovulation. We also can see in women who are overweight and obese an increased risk of miscarriage and increased risk of certain obstetrical abnormalities, which I've outlined. Again, not all women who are overweight or obese will have infertility, nor will they have pregnancy complications, but we do note that these complications are more common with increasing body mass in women. In men, body mass index of greater than 35 appears to be problematic. And what is seen is commonly reduced sperm count, reduced sperm motility, and reduced male libido. So optimally, both men and women should try to maintain as close to a normal body mass or body weight, trying to avoid being very overweight or underweight. If you are very underweight or very overweight as a woman, discuss with your providers pre-pregnancy what strategies will be best for trying to either gain weight or lose weight, so that once one is ready to attempt pregnancy, it gives us the optimal outcome. Diet is a very important part of lifestyle, and there are always the questions of what diet is the best for fertility. Well, there is no one single fertility diet that's been shown to be superior. However, the studies have shown that if individuals maintain the classic so-called Mediterranean diet, that this seems to be the most fertility positive diet that we have available. In fact, in the United States, variations of the Mediterranean diet are currently the ones that seem to be most successful for weight loss, as well as helping with chronic medical conditions such as diabetes and hypertension. So the Mediterranean diet is really based on primarily plant, whole grain, whole, real foods, reducing processed foods, refined sugars and refined products, reducing saturated fats and red meats, replacing red meats with protein sources and grain sources of protein, as well as emphasizing fish, servings of 2 to 3 servings of fish per week. So that the concept behind the Mediterranean diet or any fertility diet is that to eat healthy, and that is to eat a well-balanced diet. One point I'd like to make is it's very important not to skip meals, but eat 3 meals with 2 snacks daily, also to avoid prolonged fasting. One wants to also maintain fluid intake with water, and we should try to get at least 60 to 80 ounces of water per day in our diet. Increasing lean protein and fiber can also be helpful. Lean protein is very important to avoid saturated fats. Fiber is also very important for helping with blood sugar maintenance, for weight maintenance, and for digestion. Limiting foods with simple sugars and starches, that's where we tell patients we prefer them to avoid refined sugars and use more whole grain products or legumes, bean type products, which are more complex carbohydrates, absorb more slowly, and have benefits for both digestion and fertility. Avoiding processed foods or processed foods products is important. Many of these have preservatives or food products that are not healthy or contain high amounts of sugar or salt. And if we're looking at fats, and we do need fat in our diet, choosing the monosaturated fats, fats such as olive oil, canola, peanut, sesame, and sunflower for our cooking and our seasoning. Also avocado oil, and avocado is a good source of omega-3 fatty acids. I have a number of rules to eat by. I'll let you read this at your leisure. But certainly one of the things that we talk about in integrative medicine and diet is to eat a variety in color, to eat across the color spectrum. The different fruits and vegetables that we eat with the different colors have different pigments and antioxidants that can be quite beneficial to our health and also to fertility. As I mentioned, avoiding skipping meals. There's some other concepts here that you could certainly look at. One of which I advise is to try to cook or prepare your own food at home as much as possible. This way you have control of the sourcing of the food, the seasoning, and the quality of the food that you're eating. And food prep and storage is important. I do advise patients to avoid the use of plastic storage for food, especially for liquids, anything that's acid or warm. Glass would be a preferred storage source. And also from a drinking source, I advise you to avoid using plastic containers and use either ceramic, glass, or metal. Even the non-BPA containing plastic containers still have plasticizers that potentially can have endocrine or hormone disrupting effects on fertility. Organic foods is a very good concept. The Environmental Working Group has an excellent website, Environmental Working Group, EWG.org, and they have what's called the Dirty Dozen and the Clean 15. The Dirty Dozen are the 12 fruits and vegetables that should ideally be purchased organic. These are the dirty dozen are those that have the highest amount of pesticide residue present. So I do advise patients to consider using organic fruits and vegetables, especially for the dirty dozen, to look for organic for both dairy and poultry products, and very important to look on products to make sure that they're hormone and antibiotic free. Vitamins are a common topic that we talk about in fertility. Vitamins, any supplement for that matter, is a complement to a healthy diet. It's not a substitute for good nutrition. There are very few cases where individuals need multiple supplements if they're eating a good, well-balanced diet. We should be able to get proper nutrients from our diet. But with that said, we do advise that women attempting pregnancy should be on a folic acid supplement, at least 400 micrograms, 0.4 milligrams of folic acid, starting 1 to 3 months prior to conception. There are certain groups of women who may benefit from higher amounts of folic acid, as much as 4 milligrams, starting 3 months before conception. And that's why it's important for you to discuss with your healthcare provider in advance what your folic acid recommendations might be for your specific situation. In many European countries, 4 milligrams of folic acid is recommended for women who have a body mass of greater than 30 to 35. There are a number of very good prenatal vitamins on the market, but even the so-called best prenatal vitamin may not meet all the needs, and that's why diet is so important. So talk with your provider about which prenatal vitamin they feel you would be most benefited from. But at a minimum, we want all women supplementing with folic acid. Vitamin D is a very important vitamin, especially here in the Pacific Northwest. Vitamin D insufficiency or deficiency is a common problem, and vitamin D levels can be measured, and supplementation can then be advised based on vitamin D levels. There is some evidence in the medical literature with women with low vitamin D levels, especially less than 20, may have lower success rates with in vitro fertilization and lower fertility rates. Omega-3 supplementation fatty acids are commonly obtained from fish oil, and once pregnant, women are advised to supplement with fish oil supplement containing DHA of at least 200 to 400 milligrams per day. Many multivitamins will have DHA added to them, and commonly those prenatals will have 2 tablets, one with vitamins and minerals, and the second with the DHA as a second tablet. So again, discuss with your provider what your needs might be for both multivitamins as well as a fish oil or omega-3 supplement. No discussion of lifestyle would be complete without talking about environment. There are a number of environmental toxins that we're exposed to daily. Chemical, biological, radiation, and physical. You can see the list here. But the major area that we're going to be exposed to chemicals is going to be through food and fluids, primarily by the processing of the food products and also the packaging and storing. And that's why I advise, again, to avoid as much as possible products that are packaged in plastic, liquids that are in plastic, because plastic bottles and containers contain plasticizers. These plasticizers, typically either phthalates or bisphonates, have hormonal disrupting ability. They act like estrogen, so they can affect the hormonal environment for both men and women. So ideally, trying to avoid plastics for food and drink is very important. As I mentioned, Wi-Fi and electromagnetic radiation are issues that we worry about with cell phone. So for men to keep the cell phone off of their body, especially out of the front pockets, is important. And for men, if they work in a very high heat environment, to try to avoid that heat exposure or attempt cooling if possible. There is information, increasing information about the safety of cell phones and the radiation they give off. And this slide simply is from 2017. The California Department of Public Health released guidelines for what they feel is to reduce the risk of potential radio frequency and electromagnetic radiation and cell phones. So primarily what these recommendations say is to keep the cell phone away or off of our body, and to try to reduce the risk of being exposed to electromagnetic radiation for prolonged periods of time. From an environmental standpoint, I have a number of recommendations that this slide provides. And I'll let you read that at your leisure. I'm not going to read it for you, but all of this would be common sense. One I did not mention is fish. It is recommended that both men and women try to consume 8 to 12 ounces of fish products each week, especially when attempting pregnancy and for women once pregnant. But we do have to be concerned that some of the large sea fish have mercury and other heavy metal contamination. So there are a number of sites now available. The FDA has a very good site, and so does the Monterey Bay Aquarium, where you can go and look at sustainability and contamination in fish and determine which fish are the safest to take. Fortunately, because we live in the Pacific Northwest, our fisheries, especially our salmon and our freshwater fisheries, have very little heavy metal contamination, and these fishes are much safer for us to consume on a regular basis. Personal health care products, the reason this is mentioned is many of the personal health care products that we use have fragrances and other chemicals added, and these again are often phthalates or other chemicals that can have endocrine disrupting factors. So you may want to look into what personal care products you're utilizing and see if you can find some that are more chemical free or greener products if you would. Movement and exercise is a lifestyle that's very important. The guidelines of the United States advise that we get at least 5 episodes of exercise for 30 minutes each week, so 150 minutes of moderate physical activity. And in both men and women attempting pregnancy, it's safe to exercise between 1.5 and 5 hours per week. We do know that in women, especially women who are quite underweight or with ovulation problems and underweight, may be more negatively influenced by frequent movement. So if you're active more than 5 hours a week or very strenuous activity, discuss that with your provider. They may wish to alter your activity level or reduce it down to help with your ovulatory function. So movement actually improves fertility. There's a number of studies that show moderate, regular activity can improve both ovulation, ovulatory frequency, as well as sperm quality. Sleep is important, another lifestyle issue that in today's society, many of us don't maintain good sleep habits. The sweet spot or ideal spot for sleep for fertility is at least 7 to 8 hours per night. Less than 5 hours or more than 14 hours actually can have negative or detrimental effects on both egg and sperm quality. Shift work can be an issue for women. Women who work the 11 p.m. to 7 a.m. shift may notice some menstrual irregularities or lack of regular predictable ovulation. So if you're having an ovulatory abnormality in your work shift, discuss with your physician what options you might have. Self-care is very important when we're going through this process of maintaining good health and well-being as well as fertility. And I like to tell my patients that it's important for each of us to cover out some me time, M-E time, where we have some time for ourselves, where we can just relax and do things that are fulfilling and slow down. And these are just a couple of tools that I found very helpful for patients to try to help provide themselves some safe self-care. This is especially true for individuals or couples going through fertility treatment. There are a number of complementary treatments that have been utilized and are still utilized to enhance fertility. The more common are supplements, mind-body tools such as meditation or mindfulness-based stress reduction, and acupuncture, traditional Chinese medicine. There are other forms of whole-body systems such as Ayurveda and naturopathy. Yoga is considered a mind-body tool, and there are studies to show that women who practice yoga regularly have reduced stress scores and also seem to improve fertility. Reiki is another mind-body tool that's been utilized to help. This is just a partial list of a number of different tools available, and this is an area that I do talk to patients about, again, toward that self-care. There are a number of supplements that have been described for improving fertility. This is only a partial list for women. And I really want to make a disclaimer. Don't take this list, write it down, and then go out and start every one of these supplements. More is not necessarily better. Not all men or women are going to need supplements. This is simply a list of supplements that are commonly used. some of which have evidence-based medicine to show benefit, and many of which have no human evidence-based medicine to show improvement of fertility. Most of the data is unfortunately either models from animal studies or from anecdotes or from historic perspectives. But this gives you an idea of a wide breadth of different supplements that have been utilized to help improve fertility in women. Equally, there's a number of supplements that have been utilized for men. And interestingly enough, we actually have more data on supplements in men, showing that some of the common antioxidants in a men's multivitamin and omega-3 supplementation may help improve sperm quality and function, especially men with lower sperm quality and function based on the semen analysis. So again, this is a list of a number of different supplements that have been utilized. It's important for each individual, male and female, for their provider to look at their particular situation and make specific recommendations on what supplements may most benefit that individual. There are some natural ways that we can help boost fertility. We've talked about lifestyle, diet, weight. For men, sleep, as we talked about, is important. Avoiding long periods of sexual abstinence or ejaculatory abstinence. I mentioned cell phones, but also it's important to keep laptops off of the lap. Laptops give off heat, and they also give off small amounts of electromagnetic radiation. So most men are no longer putting their laptop on their lap. They're using a desk or something between them. Continue that practice. We talked about boxers versus briefs. There's evidence that increased intake of carrots and walnuts. Carrots would have carotenoids. These are antioxidants, and walnuts are rich sources of fiber and omega-3 fatty acids, may improve fertility. And there's a few studies now showing that daily consumption of a handful of nuts, tree nuts, actually can improve sperm parameters. Whether this improves sperm quality and fertility is yet to be determined. I mentioned fish, and the recommendations are 8 to 12 ounces, so 2 to 3 servings of fish per week. And there's also a couple studies that show men who consume large amounts of processed pork products have reduced fertility. So it's not that we can't enjoy bacon or other processed pork products, but people that are eating it on a large scale or regularly, that may reduce their fertility. With supplements, what I tell all my patients is it's very important to know what you're using before you start it. Let us, your healthcare providers, know what you're taking and what you're considering. We can help guide you. For example, in my practice, when I recommend a given supplement, I've researched that supplement. I want to make sure that supplement is really what the supplement says it is. The quality of manufacturing is appropriate, and the patient is really getting the product that I want them to get. Because when we go to the supplement counter or aisle in the stores, it can be daunting and overwhelming the number of supplements available for us to purchase. I do tell patients it's important to look for third-party certification. There are a number of certifications, but the two most common are NSF and USP. And these are independent third parties that actually test supplements for content and purity to another level to ensure the quality of the supplement that we're going to be taking. Acupuncture is an important adjuvant that has been used for fertility, both for general fertility as well as IVF. But one of the real questions is, does acupuncture actually improve my chances of becoming pregnant? And at this point in time, we have a large number of studies, some 46 now published in the literature for in vitro fertilization, but it's not universal in the agreement that acupuncture is helpful. The majority of studies show benefit or no benefit, but not harm, fortunately. And there are a number of reasons to believe that acupuncture can help improve fertility for both men and women. It can help reduce stress hormones. It can help improve blood flow to the ovaries and uterus. And it does seem to have positive effects. But the major positive effects of acupuncture may only be seen through repetitive or repeat processes. So a single acupuncture treatment may not be adequate. It may take several acupuncture treatments before the maximal benefit is actually obtained. So in attempting pregnancy, what we've tried to do is provide you some tools, and those that are actively attempting these tools are still very important. But most important is, if you're just beginning this process, plan ahead. Make sure that if you have any chronic medical problems or on medications, that you discuss those with your provider, and those may need to be adjusted prior to attempting pregnancy or once pregnant, so that we have a plan in place. And that's why it's so important to discuss everything you're taking with your providers. And also, if you have multiple providers, let us know who you're seeing so we can all work together. As I mentioned, it's important to begin and continue on folic acid throughout the time attempting pregnancy, and definitely through at least the first trimester of pregnancy. Eating healthy is an important concept that we discuss. And again, the Mediterranean type diet is the one that appears to be the most beneficial to fertility. A good multivitamin can provide a number of nutrients, and for both men and women, a good basic multivitamin may be valuable. Weight is important, as well as exercise. Smoking, we discussed smoking cessation, and also avoiding the use of marijuana or marijuana products while attempting and during pregnancy. Alcohol consumption, limiting consumption and once pregnant for women to avoid. Caffeine can be utilized, but again, my recommendation would be to limit your caffeine use to 200 milligrams a day. For men, there's no clear evidence that caffeine has negative influence on fertility. But again, I think it's probably reasonable to limit caffeine intake to 200 to 500 milligrams a day for general health and well-being. Environmental issues, as we talked about too, to avoid things that we know we're exposed to. Healthy sleep is important. Try to maintain sleep habits where you can get 7 to 8 hours of useful, healthy sleep every night. Stress management and self-care are very important. As I mentioned, take time for yourself. And one thing I've seen over the years taking care of fertility patients is okay to have intercourse or sex, even not around the time of ovulation. We want individuals and couples to maintain a healthy sex life throughout this process. And communication, very important to continue to communicate. If you're undergoing fertility or the stress of fertility treatments, communicate with your partner, your friends, and your families. Seek that social support that's very important. Thank you for your time and attention today. If there are any questions, we'll be glad to answer those now, or you can send those to ORM Communications. Thank you very much. Well, it appears at this time we have no questions, so we'll go ahead and end our webinar today. And again, if you do have any questions, you could forward them to ORM Communications, and they'll forward it to me for answer. Thank you again for your attention and attendance. I hope you have a wonderful day, and best luck in the future in establishing or adding to your families. Bye-bye.